And next we are going to go over the structure of the mouth. First, we'll go over characteristics. The mouth is the cavity in which mastication takes place. It's the beginning of the alimentary canal. In addition to that, it's also one of the first areas the decedent is going to be viewed. When you walk up to the casket, the first areas a person or a family member is going to notice is going to be the mouth and the eyes. So these areas are going to require special attention. The mouth is also the facial feature that creates expression. Okay, we're going to go into identification of mouth parts, location, and type of facial markings. They're listed here, but just like last time, I want to go back to the photo where you can actually see where they are on the mouth, so I'll go back out there. Here they are. So first we'll start with the superior integumentary lip. This is going to be the area between the base of the nose and the superior margin of the superior mucous membrane. So that's going to be the area between the upper lip and the base of the nose. The inferior integumentary lip is going to be the same, but on the bottom. So that'll be the area between the bottom lip and the chin. The mucous membrane is actually the red surfaces of the lips. As you can see in the photo, but they're gray. They are labeled as the superior and inferior mucous membranes, the upper and the lower lips. The weather line is a line of color change at the junction of the wet and dry portions of the mucous membrane. This is also the area of the mouth where the adhesive is applied to keep the lips closed after you put in place your mouth closure. Next is the medial lobe. The medial lobe is the tiny prominence on the midline of the superior mucous membrane or upper lip. It's going to be right below the philtrum in this photo, that protrusion right in the center on the upper lip. Next is a line of closure. We all know that as a line that forms between the two lips when they come in contact with each other. And the philtrum, which is the area that's right above the medial lobe on the superior integumentary lip, right below the base of the nose, that indent. And then we have the angulus oris sulcus, which is the groove at the end of the line of closure, right at the corners of the mouths. The vertical lines of the mucous membranes are those fine lines that you can see in this photo here. The fine lines on the bottom lip, and they're on the top lip most of the time as well. And then lastly, we have the labial sulcus, which is the vertical furrows on the lip extending from within the mucous membranes to the integumentary lip. This is an acquired facial marking due to age. Next, we have the description of structures. It's the intention of feature setting or rebuilding of the mouth is to look natural. We've learned to not say lifelike. And fun fact, the mouth is 2 eyes wide, if you fit into the canon of beauty. We'll move along to cosmetic application to alter expression. So there's a couple different ways to alter the expression of a person. We just went over that the mouth is going to be what creates the expression on the face. The expression may need to be altered to look more natural or realistic. When you close somebody's mouth with certain types of mouth closures, it looks very uncomfortable, not very natural. So some ways to do this are going to be to subtract or add filling material. In addition to the mouth former, you may have placed some sort of cotton in the mouth to support the mucous membranes. Some of this cotton may need to be removed, or additional cotton may need to be added. Another way is to loosen or tighten the injector needles if you did choose to use injector needles. If you used sutures or ligature to close the mouth, this ligature may need to be tightened or loosened as well. Another way would be to inject tissue builder in certain places of the mouth. Again, like we said, this is going to be one of the first areas that the family members are going to look at is the mouth. So you're going to want to be really careful with where you choose to inject the tissue builder from. We've gone over some hidden points of entry in class, one of which being the corners of the mouth, to make sure that point of entry is hidden. You can also add wax to the line of closure of the mouth to change the expression slightly. You can make the lips appear fuller with wax. Or it may be as simple as even just changing the lip color. You could use lip color on men and women, they just have to look natural. Sometimes the lips have changed colors to a dark brown, which is unnatural, and changing the lip color to a lighter pink, more natural shade could do the trick. Okay, next we're going to go over restoration of the lips. So this is the way that the book tells us to do it, but as we've learned in RA when creating facial features with the armatures, it can be done in many different ways. But the way that the restorative art book tells us is to first create the armature, which is the base. This should be a 5x5. Then you're going to want to measure the dimensions of the mouth, create a cylinder for the upper lip, create the medial lobe on that upper lip, and then go into the indent, the philtrum up here, and then the line of demarcation. So the line of demarcation is going to be that, what we went over before, that change in color between the wet and dry lip. After you finish your upper lip, you're going to want to create the lower lip, and then add the finishing details, smooth it out, and make it look natural. This can be gone over with words very quickly, but as we've learned, this is not a very easy task to do, and there are many ways to do it. So as we progress in our careers, I'm sure we'll all learn how we do it best. And lastly, for the mouth, we're going to go over the dental prognatisms. The first dental prognatism is the maxillary prognatism. This is when the superior jaw or the maxilla protrudes. That can be seen in this photo right here. The mandibular is when the inferior jaw or mandible protrudes. That we can see in this photo. That's an underbite when your top teeth fall behind your bottom teeth. And next we'll go over to this cute little guy over here who's got a dental prognatism, also known as buck teeth. It's defined as the oblique insertion of the teeth when the front teeth protrude. And lastly, we have alveolar, which is down here when the sockets of the teeth are inclined.